A group of people living with Crohn's and colitis meets regularly at the Royal Free Hospital in London to discuss how their care could be improved.
It's a group of people who have their care in one institution. Ours all have their care here at the Royal Free Hospital, who come together to work alongside us as healthcare professionals to really look at service and how we manage service and how we can do things better.
The two main forms of inflammatory bowel disease, IBD, are Crohn's disease and ulcerative colitis.
Clinical pathway groups are a way of standardising care across different hospital sites, and patient co-design is an integral part of what we do.
The idea for the panel came from the discussions around our pathway work, and so as we were producing the pathways, we realised that we needed to get patient co-production. They needed to be doing it alongside us. The first thing we did is my lead nurse sent out a patient survey, and this was the beginnings of getting patient feedback. And at the end of the survey, we asked for offers. And once we got a group of patients who were willing to come together, we then set up the first meeting.
We serve a population around this area north of London, but also tertiary referrals as well. So we have patients from sometimes all over the country, but more often than not from the surrounding counties around London.
With the patients, we've been working together to map each stage with the sticky notes about what specific things would need to happen, what specific things would make improvements for them. And obviously, as providers, we have a different perspective, and there are, blind spots for us where we don't see what it's like to be a patient on that particular pathway, and that's where it's so valuable to have the patient involvement. We run them for a couple of hours in the evening here at the hospital. They're pretty relaxed, and I run them jointly with our project manager. So there's two of us running them at any one time. And then one of the IBD nurse specialists always comes along, and they take that in turns.
Well, I've been a sufferer of ulcerative colitis for over 40 years. I've seen improvements in the service. Most recently, when there's more contact with the specialist nursing team, rather than seeing just the consultant.
Through the mapping of the IBD pathway, the patient panel identified they wanted a bit of information to signpost them in a flare scenario. We were in the process of designing a flare card at that time also, so it gave us the opportunity to put some designs and content towards them, which then led us in the direction for our final version of our own flare card for the Royal Free Hospital.
I've been able to help with editing patient literature so that it is easy to understand and accessible to the patient. Now we're reviewing all the leaflets to make sure that it contains the information that patients really need. We have seen things come directly from the patient panel into the clinics, such as changes to the appointment systems.
So the quality improvement work at the front of this process was to try and decrease the time from referral to being seen, and to fast track the amount of initial investigation so a diagnosis could be made and an appointment with a consultant could be within the first 6 weeks or so. So we set that up. We went through several cycles of, plan, do, see and act. We managed to complete that cycle on several occasions, and we have actually brought the time from referral to first treatment right down.
Both sides have really learnt a lot from each other. So the clinical team have really learnt to take on the patient's values, and the patients have really helped them understand the issues that we face in terms of managing the service.
If you feel that you are involved in your own treatment, then it's definitely beneficial, and being on a patient panel can be part of that for some people.
I really would recommend people take part, because both diseases can affect from the very youngest of age all the way through to the elderly. It's important that we get that range of input into the patient's panel.
The hope of the panel is that we will be able to feed back the first iterations of the changes they suggested.
They're so grateful for what we do, and they want to participate and help us do it better. And it's really good for those nurses to really understand that the patients value them and value what they're doing.